All right. Good evening, everyone. This is Nomad Prepper 2, otherwise known as Tony D. This is a video about when I went in the hospital the last week of October. I ended up, and trust me, I did not get the C19 jab in the arm. It ended up that I had apparently, um, possibly, according to my doctor, I might have gotten the C19. I'm relatively a healthy person. I am a meat and potatoes type of guy. I am a little past my mid 60s, but I'm generally in pretty decent health. I ride a motorcycle, a Heritage, Harley Davidson Heritage. I stay active pretty much. I'm always usually doing things. And then one day I woke up and my left leg was like 2 or 3 times bigger than my right leg. Now, I had done all kinds of exercises trying to figure out what the heck was going on and trying to reduce the swelling in my left leg. And I said to myself, Self, let's give it 24 hours and see what happens. So I did. I woke up the next morning. The swelling did not go down in my leg. I was very concerned. So I ended up calling an ambulance. And if you look on my channel here, you're going to see that I have a couple of videos that I did when I was in the hospital after the surgery. Now, I have been pretty medicated since I would say Halloween till now. And you're talking November, December, January, February here. We're talking 4 months. There was a possibility that I may have to have bypass surgery on my left leg if the swelling didn't go down. Well, it's down, but it's not down completely. In other words, it's a little bit bigger than my right leg. And my right leg is my active leg, so to speak. My strongest leg, I'll put it that way. Um, and I'm still really not sure what's going on with that. Um, Last month, I had been to the doctor's office, the doctor who did the surgery, and he told me that they want me to do another sonogram on my leg and all kinds of other stuff. But I had to get the approval from my regular doctor I see every month for my prescriptions and so on and so forth, which they sent the paperwork to the doctor, the surgeon, and they sent the wrong codes. And I still haven't heard back from the doctor, the surgeon that did the surgery, which I will probably give him a call like tomorrow or something like that. I don't know what's going on, but my live stream is screwing up here a little bit. Excuse me, it shows low bars when I'm connected directly to the Ethernet, so I don't know what's going on here. Google or YouTube or one of these channels better get their crap together. That's all I can say. Anyway, um, when you have to get surgery done, my healthcare provider is pretty good. Why I say that? is that I have Care Plus. Now, Care Plus has treated me very well. I pay zero for prescriptions. If I need x rays, it doesn't cost me any extra. If I need to go by ambulance to a hospital, it does not cost me a dime. My prescriptions are free. If I see any surgeons and need any surgeries, any specialty doctors, it does not cost me a dime. I am fully covered with my Care Plus health provider. And I have a train that's coming through here. Let's see how loud they are. As you could probably hear them rumbling on by, and as I can feel my place shaking. Um, Hopefully we don't get a derailment here. But my point is, what kind of health care do you have? Now, I seen my private doctor just last week, and he sent in my prescriptions and everything, and I went today to go pick up my prescriptions. Now, since I live in Central Florida, we have snowbirds that are down here now. I went to the pharmacy to go pick up my prescriptions. Guess what? They don't have them. They did not have my prescription ready and told me they don't know how much longer it'll be before they get it in. Oh, but we do have this other prescription if your doctor will approve it. It's a little stronger than what you're getting now. It's basically a different pill, but we have it in stock. So what I have to do, come all the way home, which is a 30-mile drive now, let you know. Just one way to the pharmacy. So to put it to you this way, I get back here, I try to call my medical center. What's going on with these people? I finally got a call back from one of the representatives there because I had her personal phone number. She's kind of a friend, I'll put it that way. But my point being, I gave her the information. Now, I had called the medical center, asked to speak with a nurse. They transfer me, and I get an answer machine. You try to contact anybody else in that medical center, and all you get is answering machines. What's going on here? How come these people don't answer the phone? Of course, on their answering machines, it says, if it is a emergency, please call 911. Well, no, I don't have an emergency. Well, in one aspect, I guess you do because I need this medication. But it's a good thing I had the phone number of one of the representatives at that medical center because she had contacted the nurse that works with the doctor. He was at a different office today. Now, I don't know if he called in the prescription or not, or if it'll be done tomorrow. But I will need that medication tomorrow. But why don't people answer the phones at these medical centers? We pay for our medical coverage. We should not have a problem getting through to these medical providers. These medical centers are there to take care of us as the patients. So this is something that kind of has me a little teed off, if you will. Because when you need medical advice or need a different prescription filled because the prescription they sent in they can't get, and to give you a different medication or a stronger type of that medication, they have to send in a different prescription. So what's that do? It delays everything. This could have been a life or death situation. And I'm hoping tomorrow that that will all be resolved and I can go pick up that medication I need. But I want to let you know, once I do get in contact with that surgeon that did the surgery on my leg, I still may have to have more surgery. Like I stated, bypass surgery on my left leg. If the swelling isn't going down all the way, then apparently there's still some kind of blockage. Now, I spoke to my regular doctor about this, and I told him, you know, something still isn't right. I had blood clots all in my left leg, and I have blood clots in my lungs. Is there a possibility that I have more blood clots in my body? Well, my doctor was like, oh, well, well, guess what? Now they have set me up to see a hematologist, if you want to call it that. So I guess it's a heart doctor, heart surgeon, however you want to look at it. So I'm hoping that this gets resolved. Because if I had a blood clot, if my whole left leg was full of blood clots, and I have blood clots in my lungs, as the surgeon suggested, who's to say I don't have blood clots in other parts of my body? Now, I have not had the energy that I should have. Okay, yes, I am a little bit older. But there's people I know in their mid 70s. They can run circles around me now. I used to be a workaholic. I used to work 2 jobs a day. I also, for 20 years, drove tractor trailer over the road, and I was always go, 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 go. Now, what do I want to do now? Since I've had the surgery done, I want to sleep all the time, which keeps me from getting other things that I need to get done taken care of. So I don't know how you people feel about it, but this is why I brought this up about your healthcare providers. This is why I showed videos when I was in the hospital, and they're here on Nomad Prepper too. You can find them here on YouTube. But like I say, what kind of health care do you have? How well do they take care of you? Do you get proper medications? Do you get too many medications? Because, like I had specified to my doctor this week, am I taking too many medications that are working against each other? Is that why my energy levels have dropped? Now, I'm a person that everything in my body works. And still wake up in the morning, boing, you know what I mean? I don't have any real body part issues. I do have, some back problems. I am borderline diabetic. Don't take any medications for diabetes because I'm not that much of a diabetic, so to speak. They tried putting me on pills one time and I started convulsing and stuff. And it was like, oh, no, 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 drop my sugar level too low, too quick. And they were like, oh, no, yeah, no, you don't need them. You don't need them pills. You're not that big of a diabetic yet, type thing. And it's been, I mean, I've been like that. So, okay. As far as the surgery went fine. The nurses and the doctors were fine. I only had one minor issue with all that. They didn't give me a sponge bath until the night before I was transported back here where I live. That's a whole week without anyone giving me any kind of sponge bath. I wasn't too happy about that. One other thing that I wasn't happy about, they feed you intravenously, so you don't have bowel movements and all this. You don't have to urinate and all that stuff. But instead of feeding me, how would they? How they? They're supposed to feed you intravenously, which is fine and dandy. But it wasn't really nutrients they were feeding me. It was sugar water. Now, for someone who's borderline diabetic, why would they feed you sugar water? And I still didn't lose much weight either. Hardly anything. Which surprised me. Probably because of the sugar water they were feeding me to keep me fat, I guess. Now about 195, 6 pounds. I'm trying to lose weight. I'm trying to, I'm lucky if I eat twice a day. I don't know why my weight stays on me. Is it lack of exercise? Is the medicines that I'm taking keeping my weight on and keeping me from getting proper exercise? Well, after I get these things taken care of here during this next week here, I'm going to see if I can go to the nearest gym and start working out in the gym and see if that's going to have any effect on me and how I feel and things like that. But my point was, find out what kind of medications you're taking. Read the side effects on those medications. Read what they can and cannot do. What could be dangerous for you on these medications? A lot of people take, I'll give you a good example. Okay, Eliquis. It's a blood thinner. Why am I taking a blood thinner? Okay, yeah, I had blood clots. Okay. Well, my regular doctor this week even says, oh, well, you're still taking that? I go, yeah, I got 3 months supply. How long do I got to take this crap? I nicked my finger and bled for 8 hours. And it was just a little nick. That's not me. So why am I still on Eliquis? Oh, and then what's another thing they give me? I couldn't pronounce it if I wanted to. I can't show it because my name and everything's on it. But it's another bunch of pills for heart medication. It's a heart pill. to keep you from heart defibrillation. I got a strong heart. Why do I got to take heart medications? That's not the only one. They got me on another one besides that, lisinopril. Why do they have me taking 2 different heart medications? And then you read side effects, could cause heart attack, could cause death. Are they trying to kill me? I think so. I didn't get that poke in the arm. And here they're giving me all kinds of medications that could cause me to have a heart attack. Real nice, huh? Excuse me. But I just wanted to get this out there to you people. Know what you have for medications. Watch what you take. My medical provider, Care Plus, had called me last month, which I forgot to talk to my doctor about. They want to send me Narcan. That's for druggies that overdose. Well, they want me to have some on hand here just in case I happen to take the wrong medication at the wrong time or something and possibly OD or get close to OD. That's why they want to give me the Narcan. Well, they're giving this Narcan away. Sheriffs are going around to different places and giving people this Narcan, which is fine. I don't believe I need it, but I would like to have it because I do know people that are addicted to drugs. They do have problems. And if they were to OD, I think it'd be a good thing for me to have that to save their lives if need be. But like I say, watch the medications you take. Hopefully, you don't pay an arm and a leg for your health care. These health insurance companies, they're making people go broke. And you just don't need that. But that's why I'm suggesting you check out your policy. See what kind of provisions you get. And if you're not getting what you need, check out other healthcare providers. Like I stated, for me, I don't pay for an ambulance. I don't pay for my medications. I don't pay to see specialty surgeons or doctors. I don't pay for x rays. I don't pay for any of that stuff. You should check and see what you get for you and your family. These are things that everybody should be concerned about, especially with all these things that are going on in this country. Be aware of your surroundings because, like that train derailment up in East Palestine, Ohio, there's toxic gases that can kill you that are released into the air. It's killing animals, killing fish, contaminating water, land, everything. It has destroyed that whole area and can cause permanent health damage to people. If it don't kill you first. You have to think about this stuff, people. These chemicals that were released and burned, these chemicals were the exact same chemicals that were used during World War I. to kill and gas out soldiers. It's killing fish, it's killing pets, it's killing livestock, it's contaminating the soil, it's polluting the Ohio River, which is going to travel all the way down to the Mississippi River. We're talking over 1,000 miles of damage to our environment and animals and even possibly human beings. Now, why I say this stuff is because contaminated water with the chemicals from this train, you better do a lot of research and check out how long you may have to drink your spring water. Or go to your local grocery store and get the 5-gallon jugs that you'd use in water dispensers. Because if you drink contaminated water, it can kill you. These chemicals are cancer causing. That's why they're getting burning in the eyes, the nose, the throat. Having problems breathing. Pets and livestock are dying like crazy. It can cause your organs to shut down. Your liver, your kidneys, your pancreas, and cancer. This is why I brought this up tonight. People, you need to know what you're dealing with when it comes to health. You better know how to treat things. And the way things are going nowadays, there's a possibility that we could be involved in a nuclear war with Russia or China. It could happen here on American soil. Do you have potassium iodide for such an invasion? Do you have a gas mask for the people that lived in Ohio? I have suggested get out and get your N95 face mask. The stuff that you were using during the C-19, those cloth masks like the doctors and nurses use, that ain't going to help you. Because those chemicals can get right through that, no problem, if it don't eat the cloth right off of your face. These here, this little respirator here, that protects you. This face mask, this is an N95 face mask. You can get these at, say, Walmart in the paint department, Home Depot, Lowe's, Walmart, like I say, in the paint sections, or get the regular face respirators with the 2 filters on both sides. Get these items. It's good to have them on hand. And everyone in your family should have them as well. If you don't, you better have a gas mask, because these gas masks are going to save your life. These are things that you need to have. Now, I've had this gas mask for well over 20 years. Is it a good gas mask? Yeah. Do I have the filter for the gas mask? Yes. I want something better than that one that I have. But they cost a couple $100. I want the full face gas mask. This one here's got the eyes, which is fine. I mean, I can see out of it and everything. But I like the full face that I could see around better. But I just wanted to bring this stuff up to you people, because our health is important. If we don't take care of our health, we're going to be pushing daisies. I want to stay alive as long as possible. If it wasn't for these medications and the surgery I went through back a couple months ago, I'd be fine. I was out on my motorcycle today and I enjoyed it. Nice 80-degree weather. But I live here in Central Florida. We've had some cold spells down here, and I hate cold weather. That's why I moved here to Florida. But I wanted to bring this up about surgeries, your medical coverage. Make sure you have the right policy that you need. Watch what your doctors are prescribing you. A lot of times doctors don't mind. They'll write you all the prescriptions you want. You know why? Because they get a kickback, a money kickback from these pills that they prescribe you. They don't care about what happens to you unless they're friends with you. It's like what's going on with the EPA and all these other government officials up in Ohio, where the train derailment happened. After a day, they tell people, oh, yeah, you can go home. Everything's fine. No, everything isn't fine. People letting their pets out and their pets aren't coming back to the door. They're dying right in their yards. People have got farms, chicken coops. Chickens were fine. As soon as they started them tanks on fire, guess what? No more chickens. They died. How about horses, cows, pigs, goats? All these animals. If you don't get them out fast enough away from that area, they're probably dead now. But you got people like Pete Buttigieg, whatever the heck it is. Why is he in charge of the Department of Transportation when he did nothing to help the people from this train derailment? What happened with the Environmental Protection Agency? How come they weren't there to make sure the people were gone and out of there, evacuated? You know, you're talking a town with 2,000 people in it. How come they didn't evacuate all them people and tell them, stay away for at least a week until we get the area cleaned up? No, they told them, come back the next day. You're fine. No, they're not. They're still getting burning of the eyes, the nose, the mouth, the throat, the lungs, having problems breathing. Well, you're being poisoned. The government doesn't care about you and me anymore. All they care about is themselves. I believe it's almost time for a personal war. We, the people, against our government. I think it's time that we overthrow our government. We have these Satanists as a president, a Satanist. We have these people that belong to the World Economic Forum. They don't care if we live or die. All these politicians are bought and paid for by these elites. They're getting their pockets padded with plenty of money. They could care less about you and me. And they work for you and me, and we're not getting the things done that need to be done. They're doing everything they can to destroy we, the American people. They're driving us all into poverty. There will be no poverty, middle class, and upper class because they're driving everybody to poverty, except for themselves. I think I've said enough for now about surgery and healthcare and getting off into this little rant on these other things. But take a good bit of time. Think about what I've talked about here with your healthcare providers, the doctors you see, what they're prescribing you. Read into that. And always Keep your head on a swivel. Watch what's going on. Because, like I say, these politicians, they don't care about you or me at all. All they care about is lining their pocket and doing what they want to do. And they laugh. Oh, yeah. The only time that they're speaking the truth is to each other. As far as I'm concerned, when do you know a politician's lying? When his lips are moving. Yep, you can count on that. Anyway, I'm going to be doing my live stream here on Nomad Prepper 2 every Wednesday evening at 6 p.m. I will get into doing some live streams, and I will be putting some videos up like I stated I was going to do. I'm going to get back into this routine again. Once I start going to some motorcycle events, I will be posting videos on that as well. So on that note, people, keep your head on a swivel. Watch what's going on at all times. Because if you don't watch out for yourself and your family, nowadays, nobody else is. Take care. Pray up. Prep up. And like I said, keep your head on a swivel. Watch what's going on. Take care, everyone, and have a good night. This is Nomad Prepper, a.k.a. Tony D. God love y'all. God bless us all. Good night, all.